All right, so we're back. We are going to, in this episode, we're going to combine two topics. The first one, we want to cover other viruses, other respiratory and some non-respiratory viruses that are kind of acting out or acting kind of weird in this. I can't say post-COVID because we're not out. We're in year 3 of the pandemic, but as we are emerging back into seeing people and going to school and going to work and things like that, we're finding that some viruses that we thought we understood or that we saw at certain times of the year are acting weird.
Yes. So let me just give you the clinical perspective for our listeners, was that, again, I practice in internal medicine and pediatrics, and these kids are coming in with all these respiratory viruses. My little one has spent the last 3 months, every 2 weeks, he's gotten sick. Every 2 weeks with a new thing. And he's still like, he just got another one. He just got off one, and then he just got another one, and he's still coughing. It's like so annoying. And it's been 3 months of him just coughing, and it's always these new infections. And we're like in the summer, and I'm like, come on, are you kidding me? Like, what's going on? When I took him to his pulmonologist, he was just like, I'm getting slammed because of all these illnesses that were supposed to be done. Right. They're still going along. Right. And the flu has not disappeared yet. We're like, what is going on? And so Dr. Amy is going to talk about the science of this.
Yes. So what I've been reading about and also hearing about from people like Dr. Tony and other friends that have younger kids who I think we affectionately call Petri dishes. They pick up everything, and that's actually it's annoying, but at the same time it's a good thing because this is obviously building their immunity, playing with dirt, all that, good for your immune system, kind of like getting more memory built up, training the immune army, getting everything ready to be able to fight anything that comes your way, right? But we're noticing in this kind of like as we're emerging back into like somewhat normal or more normal routines like school and work, socializing, things like that, is that some of these viruses that have a seasonality typically, like we'll only see them like in the fall or winter, things like that, they're coming back. They're here at weird times, and they're also maybe acting a little bit differently. So I just wanted to talk a little bit about that. So through my reading, I've been seeing that these young kiddos primarily in April and May have been infected, and I think increased hospitalization with viruses that we typically see like in the winter months. So we're seeing this shift in seasonality. So there's like respiratory syncytial virus or RSV, influenza virus. So the flu, like Dr. Tony was saying, the flu is not, it's not gone. It's usually gone at this time. Like we usually don't see it, and we see it reemerge like, in the fall, but we're seeing flu like, right now, which is a little unusual. And that also, I think, because Dr. Tony needs to be kept on high alert at all times. When kiddos come and see her in her practice, instead of like, oh, this can't be flu because it's not the fall, high alert, flu is now at any time. RSV is like at any time. We're also seeing cases, clinics and hospitals are seeing cases of adenovirus and rhinovirus and these other viruses, I think a little bit more commonly right now than those would mostly go up a little bit in the fall, So again, this shift in seasonality, which I think we don't understand exactly why. We have, some clues could be And Dr. Tony, jump in whenever you want to, but we as scientists, we like to think about, well, why, or why is this happening? Some of it we think is, because we've been more or less sheltered for a couple of years, that, as we reemerge and these viruses, happen to be out there, our immune system is maybe just a little bit weaker than normal, in the sense that the immune cells, a lot of people don't know this, but immune cells, I think of like immune cells as being very social. they they like to kind of have continual interaction or tweaking or things like that in order to kind of keep it at their best, right? So memory cells, when we get a vaccine or we get infected, we create memory cells, and that's the whole point of being able to fight something off. You're training your immune system. You're going to fight things off later because you have memory. And there are some particular cells, we call them B and T cells, but these are the cells that can make memory. And memory cells, memory immune cells, we've actually found in scientific research that in order to kind of keep at their best, at their peak, they need a little bit of socialization. They need a little bit of reminding, with maybe exposure to the virus or things like that. So I like to think of these memory cells as being a little bit social, and they need that kind of reminder to kind of stay, up and alert and at their best. We, of course, we still have memory, but it's going to be a little bit better if it has that kind of reminder. So it's possible that for over this kind of 2-year kind of in shelter mode, those reminders haven't been there. So our immune system may be a little bit kind of weaker. Another thing to keep in mind is that we know that there is such a thing as climate change, and that the climate, the globe is warming, and that maybe we're going to see a shift in seasonality in some of these things anyways, because seasons are obviously, things like that are affected by temperature. So we have to keep in mind that that is another possibility, that as the temperature rises with the earth, that things are going to start to move as far as and shift as far as, when we see viruses. So I think keeping that in mind, we're probably going to have to be on high alert for all of these things all of the time. So that's, and again, these are just, hypotheses or, potential thoughts on why these things might be happening. Another thing that I wanted to bring up, and Dr. Tony, I don't know if you've seen this at all, but there have been increases, now it's still small, but increases in cases of serious hepatitis in kids. So inflammation.
Thankfully, I haven't seen it. I've read about the case studies that have occurred. But I have, thankfully.
Yeah. But I've been reading about it. And again, it's small numbers, but it's higher numbers than you would expect to see for kids with hepatitis. Now, again, we don't know exactly why. Some people are thinking, there are a couple of hypotheses. Some people are thinking that, and so there are a couple of viruses that typically cause hepatitis. In these unusual cases, these usual suspects aren't the ones that they're finding,
right?
Which is, again, kind of weird.
Right.
One virus they have found that they're not exactly sure if this is what's causing the disease, but it's called adenovirus 41. Adenovirus usually is respiratory,
right?
Causes respiratory. And so right now people are starting to see this adenovirus 41 a little bit more commonly associated with some of these hepatitis cases. So they're thinking, maybe this adenovirus 41 is acting a little bit differently and maybe causing some of this hepatitis in some way. Maybe, maybe not the other thing, maybe there are other things at play as well. Some people think another hypothesis, they're suggesting that maybe it's your kiddos that have had SARS-CoV-2, so had infected with COVID, maybe there's some type of exacerbated immune response that causes the inflammation in the liver with these kiddos. And then another hypothesis is thinking that maybe there's some kind of symbiosis between SARS-CoV-2 and adenovirus 41 that's causing this
Oh no.
cases of hepatitis. So again, and then I would go further with the fourth hypothesis is something we don't know. Something we have not yet discovered, right?
That's true.
I don't know. I mean, that's the thing, is science is always changing, and the more kiddos that pop up with this, the more research that's going to be there. But that's another thing that has been concerning to physicians and scientists, is these unusual cases of hepatitis that have been kind of popping up. Again, the more cases, the more research. But right now, we don't exactly know, what's causing them.
Can I throw a curveball
Yeah.
question?
Yeah,
to
please
you,
do.
that I've never really been able to answer fully
Yeah.
myself, since you have studied virology, is why is it that these diseases or these respiratory viruses came
Yeah.
back? Why did they come back if we shut down?
Yeah,
If the
like
country
where
shut down, where the heck did they come from?
where are they hanging out?
Mhm.
Yeah, like what's the reservoir?
Yes, exactly.
Right, like, so the reservoir, like where's the pool of
Right.
flu or RSV? Like where
right.
where is it hanging out?
Where is it chilling?
Yeah, I think that's a really good question. One thing, and so the answer to that is I don't know, but one thing we have to keep in mind that could potentially explain it is that we're a global community, in the sense that we can hop on a plane and go across the globe at any point in time. And that means people can come to us that are carrying things from other places, and we can take things with us to other locations. So, I think it's a possibility when things opened up and air travel and cruises, which, FYI, will I ever go on a cruise? I have been on one. It was to Alaska. It was beautiful. Will I go on another one? I don't think so. But anyways,
I've been on a few, and
yeah, I mean, that's just a lot of norovirus,
a lot of, that's the thing. I didn't eat much.
Yeah. But anyways, that's a tangent, but
Yes.
because I think, to answer your question, I don't know where the reservoir pool of these things would be, but because I think people got so excited, like, oh, I can go places, like I'm going to fly somewhere, I'm going to drive somewhere, I'm going to cruise myself somewhere, all these different things. I think what happened is it's a possibility that just some of these things were being transmitted from different places, maybe, so I don't know. I had the same question as you. It's like, what is it, just hanging out at the corner waiting for my kid to walk by in that freshly coughed pocket of air? Right? Like
do kids just magically
yeah exactly. So I have that same question, but I think I kind of chalk it up to people probably getting excited about reemerging and going places. I mean, I personally know of a lot of people that sheltered very diligently, and then once everybody's vaccinated, and then kind of were like, we're gonna go on a vacation. We haven't been on a vacation in 2 years.
Right.
We're gonna do it.
Yeah.
So, and even if you don't go somewhere and your kid gets RSV or flu or whatever, it might have been brought from somewhere else by someone who traveled. That's the thing. We're a global society, I think. And that's one of the things.
Also, I think it's important that some of these, like RSV in particular, is not just a respiratory droplet. It's like contact. So like it can live on surfaces.
Well, that's exactly right. Some viruses are fomites.
Yeah.
In the sense that they live on
Fancy word alert.
I know they live on surfaces. It's like, viruses that live on surfaces, like, like a phone booth or like a vending machine or a doorknob, whatever,
Right.
They can live. So some viruses do that, others don't, so that's, I think that, and that's one of so on a tangent with the global community, that's one of the reasons why until we are all vaccinated, no one is vaccinated. No one is protected. Well, actually, people are vaccinated, but no one is fully protected until the world is vaccinated.
Well, right. It'll keep kindling and it'll keep bouncing around. And there's no,
we're going to whack-a-mole for the rest.
RSV, adenovirus, rhinovirus. There's no vaccines for those viruses. So that's why they keep coming back and they are not leaving us alone, because that we can't find viruses for those particular infections, human metapneumovirus is another one, right? Like that's another famous one for kiddos. It looks a lot like RSV, and makes them really sick. They cough a lot. They're really sick. Their oxygen levels can dip, and so there's a lot of co-infections. So there's a lot of like paraflu and influenza together. There's just a lot of co-infections. It's bad right now. For whatever reason, it's just like there's an onslaught. And I think what also, I'm in agreement with you. I think that as I've been reflecting about this too, we're so used to like cold months, colds, summer months, relief. And then what happens is that like because of the shifts that we've been talking about, kids are like more like summer, let's hang out, let's be more together, more parties, let's find the parties are coming back, the children's parties are coming back, and folks are not wiping down the way they say they're wiping down. They're not doing it, because if they did, none of these things would be happening, right? So like daycares and schools, they're all getting, let's be real, they're not wiping down and Lysoling the way that they did at the beginning of the pandemic. Because in the beginning of the pandemic, there was not a cough to be had in some of these daycares. Like things were real, like I was like, whoa, it's been 2 months and Anthony hasn't coughed. That's pretty amazing. And that'll change this year.
Totally. I agree. Like usually, it's fall and winter. We're like prepare for all the bad viruses and colds and germs and whatever. And then summer, it's like, woohoo. And I think with the pandemic, we're more than ever like, yes, I'm getting out there. And the masks. I mean, I go places, I'm still wearing a mask most places, like the grocery store, when I walk in. I am one of the few.
Me too.
I just traveled by car from Colorado to California, through Utah and Nevada and then back. I got to tell you, I got a lot of weird looks in convenience stores and gas stations and grocery stores. I got a lot of weird looks. Like
we're trying to keep our COVID-free streak going.
I know exactly. Still COVID.
Trying to keep it going.
People are looking at me like this.
Everybody's getting sick around me. Like a lot of COVID is, a lot of vaccinated folks are telling me, thankfully, they're not sick. They're not really sick. They're like a couple of days of, cold symptoms or whatever. But folks that have been going 2-3 years, like now, that have not gotten it are getting it because everybody's letting their hair down. Tony Esolen and crew is still using their mask. I'm like, I'm not getting it if I can help it,
That's right.
And
that's right.
Look at me weird. I don't care.
That's exactly, that's exactly the way I was. Like, we're traveling and, we'd go in and we're the only people in there wearing a mask, and everybody's looking at me like that freak lady. She still thinks COVID's around. And it's like, that freak lady knows COVID's around.
COVID's still around, friend.
COVID's still around. I'm not going to go into that gas station bathroom following the 10 people that were in line before. Well, actually, if that was the case, I would just pass. But
Right.
Like, nope. If I'm going to get COVID, if I'm going to get it, I'm going to go down like in some amazing fashion. Like it's not going to be a gas station bathroom, You're not
going down by a gas station bathroom.
You know what? It'd be like, I'm going to be at some concert where Dr. Fauci is the one talking, but of course we'd all be vaccinated and mask wearing. But my point is, I'm like, I am not going down here.
Yeah, that's right. Well,
But
you
the
know,
point-
you can only try. All
that
you
was
can
a-
do is try.
Exactly.
You know?
That was a long tangent to say that, yes, a lot of people, most people have relaxed. And because of that, I think we're starting to see these viruses taking advantage of the human kindling that are still susceptible to RSV and influenza and adenovirus and metapneumovirus and parainfluenza virus and all these other things that we're happening to see right now. And like Dr. Tony said, some of these kiddos are coming in not just with one, but sometimes 2 or 3 infections at the same time, because you can get infected with more than one
And
virus.
I saw it often when I was in residency. I saw that a lot.
Yeah.
With multiple, more than one. But it's coming back. It's like we're back. It's coming back, and the breaks that we used to look forward to have not occurred.
I don't think, I think we cannot count on those breaks anymore. And the thing is, like with the more than one infection, it's not like one virus takes over your body and is like, stop.
Right.
All other viruses, this is my territory. Not the case. Like you can be infected with multiple at the same time. And that's what, some of these poor kiddos are coming into contact with. One thing to add to this that I was reading about is that an interesting, I don't know if I guess interesting is the best word I can come up with right now, but like for kiddos that were born during the pandemic, right, that have kind of been sheltered for like their first 2-3 years of life and maybe beyond, it's going to be interesting in the scientific kind of way. Like, how is this going to affect their immunity and their long-term, like, down the road responses to things, because they're just not having the same type of interaction. Like it's, Anthony being 4, almost 5, at least he had a couple of years where he could be a full-on petri dish.
Oh my God. And was he a petri? He fulfilled that job description very well. Let me just tell you. But you know what I would say is that I think I would, again, this is all speculation, guys. We're just, but I think that what I can say is that there are children who like stay home and don't actually go to daycare for a couple of years anyway, outside of the pandemic. Like they're just able to, for whatever reason, they're able to have their family take care of them or whatever. And they and they just end up all the hacking that Anthony has done in his early life, they end up doing later on. So no matter what, it's going to get you.
Right.
It's going to get you no matter what.
Right.
It's just a matter of when. And so a lot of the times, if your kid has been in daycare since 3 months old, like Anthony was, he did get that break during the pandemic. But those kids, their hacking usually ends, 6, 7 years old or so. They're kind of like, now they can come down with colds and live through it and be done with it, But for those who had like delayed, like maybe didn't get involved until they were 3, maybe that goes until 10, who knows, right? Like it just all depends, again, on the person's immune system. It depends on their environment. And so who knows who actually.
Another thing, I think would be important to think about is, and this has also come about in my reading, is that it looks like routine vaccinations for kids during the pandemic went down. And that we're still not seeing all of those kiddos getting caught up. So one of the things that you could do to protect your kids, even during this we're still in the pandemic, is to make sure they're up to date on all the recommended routine immunizations, because protect them from the things that they can be, all the things that we have vaccines for. Go ahead and get them vaccinated and make sure they're up to date, because you don't want them to fall behind and then, come down with measles or something horrible,
right?
Down the road. That we have right now, we have great vaccines against. So
that's right.
That's one thing I would say. So I think probably in summary, for all these like other viruses acting weird, is we have a lot of, we're going to continue to collect data on all the patients that come in and try to decipher it. But I think we don't exactly know why these viruses are kind of acting weird, except that we just have to now be on high alert at all times, I think, for viruses, and not necessarily think of them as seasonal like we used to, because we're starting to see different patterns or shifts in seasonality, or maybe no seasonality.
Right.
Maybe we just think that flu's all the time.
Right. Well, in warmer states, their seasonal patterns are different than in the colder states.
Yeah.
And so I think it's important also to understand your community and your community's pattern.
Yep.
If this is something that really interests you, you can find that information in your health department Google search, right? For your particular community. To know, is it seasonal or is it not seasonal? Like for when I trained in Florida, RSV was year round. We didn't have, there were some peaks and valleys, but for the most part, I wasn't surprised to see RSV in the summer, right? Mm-hmm. Because it just wasn't unusual, right?
Right.
So it's just knowing your community, knowing your patterns. And just now that I'm in a colder environment, I'm in New York, it's completely different, right?
Yeah.
And so everybody's like, what's going on? And we just have to get to a place where we are seeing that we're in a new norm. And so what does that look like? And how do we prepare for it, right? How do we make sure that we are prepared for it?
Yeah. I mean, I think that your point about Florida, that makes sense, because you really only have one season.
That's it. Yeah. So, well, actually, I take that back. There were times when we were snobs and we would talk about our winter months that were January 14th to January 17th. Okay. Where it was,
Ooh,
it was like 40 degrees.
3 days.
And for 3 days. And everybody was like, bust out the earmuffs. This is ridiculous.
Yeah. Hey, speaking of that, I just want to tell our listeners here that I remember that you came to my wedding.
I did.
You came to my wedding, and you came, which was awesome, which is in Minnesota,
yes.
in June 1st. Yes.
Mm-hmm.
And you also came to our after wedding party the day after. You know what I'm going to talk about, right? Where all of us Minnesotans and pretty much every other guest, it was warm. It was for Minnesota. It was warm, right? And guess who was wearing a winter coat?
I'll play that. Okay. I do not like being cold. It is not fun. Mind you, I spent 9 years in Rochester, New York, okay, doing my MD and my PhD, and I never warmed up. It was never like, never, ever. You know what's really funny? When I moved to New York, they made fun of me also, because when I moved back to New York, mind you, I'm a native New Yorker, okay? And I moved back from Florida, and it was like September, and I had a winter jacket. It was 50 degrees. And I was like, brr. I was like, this is terrible. And I got mocked so heavily. I
think that day was like 65 or something. And it was just hilarious. You were like in a winter coat. We were just
Did I have a scarf? I feel like I had a scarf.
You might have, but I will tell everyone there was a pool, and there were multiple people that were swimming.
No, ma'am. No. That's not going to be me.
Yeah. So anyways, yeah,
that's hilarious.
You are tough.
I am not playing games. My good years were in Florida in terms of temperature. I have to say.
Yeah. As a Minnesotan, I hate being hot. It's weird. Yeah. I know you and I are opposite. You could have all the equator. I'll take all the North and South Pole. That's how we share the globe.
Great. Awesome.
Can we take just a real quick break?
Yeah,
and I think we're going to come back and talk about
long COVID.
Long COVID. More you than me, because you the people will find out you helped with a webinar. So
I've been studying for a few weeks now.
Yes. Getting ready for the podcast exam.
Exactly.
All right. I'm putting us on hold. All right. We are back from our little break. It's now going to be Long COVID, brought to you by Dr. Tony.
Oh, Brought to you by me. Okay, this is probably going to be a quick one, but wanted to give some information for those of you who are confused about long COVID. I wanted to try to give you some insight as far as I understand it. The good news and the bad news is that we still don't understand, to be honest. Like we've said over and over, we are still learning. We are still in this pandemic and we are still learning every day. And I think that now, 3 years into the pandemic, there is much more attention being shifted toward long COVID than has been in the beginning, because acute COVID was what was killing folks, and people had all of their attention on acute COVID. And so now let's talk about long COVID, because this is the long-term consequence of actually being infected with COVID. And so I was fortunate enough to go to do a continuing medical education with the health department about long COVID, and got a lot of really good information. It was a really well done webinar, I have to say. And so I wanted to share what I understood with you. So the first thing I wanted to say, and the reason why I think it's important to just talk about this a little bit, is that number one, again, we don't really understand it, but number two, to say to those of you who think that things are different since you've been infected with COVID, that you are not imagining it, right? Like, so this is a real phenomenon, and no two symptoms are alike. One of the things is that, one of the things that I wrote down, which with exclamation points, is that there are between 50 to 203 different symptoms documented of long COVID. Yeah. 50 to 203.
Wow.
Yes. So
quick, can I ask a question about that?
Sure.
With people that have long COVID, do they often have multiple, or can it be even just one?
It can be just one.
Okay.
It can be just one. And so categorizing it, screening for it, all of those things are still in process. Which has made it really frustrating for patients, right? So for folks who have actually experienced this and tried to communicate with their providers about what they're feeling, honestly, the providers are still learning about this. And so they're not, a lot of the times they can be dismissive. And so what's important is that, I want to help advocate on behalf of patients as well, to just say that, don't quit. If you feel that like think something's different, don't quit. Make sure that you get the ear of somebody who's going to listen to you. And if your personal provider, for whatever the reasons are not able to give you that attention or give you that reassurance, or not even reassurance, but like maybe point you in the direction of where you can get an answer, keep going until you can find more information and find somebody that can actually direct you. Now, depending on where you live, there might not be a center or a clinic where they're actually managing this. Thankfully, I'm in New York, and there are a couple of long COVID clinics. So there are places where you can get this comprehensive care, which you would probably need as a person who's suffering from long COVID. But you can say, if you're not feeling the same, if you feel like something's off, probably something's off, right? It's not your imagination. And I think that's the one thing that I wanted to say that's really important. The symptoms cross 3 different organ systems. One is your neurological system. So you might have heard of like memory loss and brain fog, and some people who feel like they're having a stroke. They're not even actually able to express themselves the same way. They feel a little bit slower. There's actually been some psychiatric illnesses that have been associated with having long COVID, having had an infection with COVID. But the brain fog / dementia symptoms are the ones that are the most prominent. And fatigue, right? Like the fatigue, that exhaustion that you feel after you've had COVID, even when you've had a regular infectious disease, like you just feel slammed and you're under the weather and you need to lay down and you kind of can shake it off. With long COVID, you can't shake it off. You're just tired all the time. And it's different. And the key to understanding whether this is you is that before infection, you were fine. You could walk up a flight of stairs. You could, dance for 15 minutes. You could, cook without forgetting where you were at, right? Like, or what you were doing. And now that's different for you, right? And so like a lot of the times people will say, well, I don't know how to tell this from age-related differences. If you're 35 or you're 40, it's not age-related, right? Like that's likely not age-related, So there's the neurological system that actually does get affected. Then there's the pulmonary system where you just feel like you can't catch your breath. There was a patient that was on a panel in this particular webinar who was explaining her situation. Not even 50 years old, was a totally fully functioning human before COVID, got COVID twice, unfortunately, and just couldn't even finish a sentence. She was just like, I can't, and she was so frustrated because people they would think she's exaggerating. And she's like, I don't want to do that. I'm not interested in doing this, like I'm not interested in pretending that I can't breathe, and so anybody who has asthma, like think about that kind of a feeling without your inhaler, all the time, just really unable to breathe fully and just weak because your lungs have muscles around them that help you expand and contract your lungs, right? And so when that gets tired, that gets fatigued, you need to take a break. Just like if you're lifting weights, right? You need to take a break after it burns. You're like, I can't keep doing this anymore. The muscles around your lungs also are the same. Basically, they need more time to rest and recuperate after you've had a COVID infection, and that requires a lot of rehabilitation.
I've read about some small numbers that I've read about, but some people that are like long distance runners or, really good at track and, can't go back.
Yeah.
The respiratory system really, is just not the same.
It's just not the same. And, that's not to say that we won't learn in 5 years that after 5 years of rehab, they can get back to normal, but that's hard. that's just really hard. And then the final one is cardiovascular. And so like we've been talking about the myocarditis, the inflammation, there's chest pain. There could be sharp chest pain. There can be some heart failure. So really understanding your body and knowing what you had before and what you have after is really important, and the things that you need to pay attention to. Interestingly, like we said in the beginning, in one of our earlier podcast episodes, this time around, children are not immune from getting long COVID. And so they are getting long COVID. And like with anything in pediatrics, it's vague. You can't get kids to communicate to you what's wrong with them, right? So everything manifests as a stomachache. And so a lot of them, the prominent symptom of long COVID in children is having this persistent stomachache. And so again, just watching for what was your norm before and then what is it now is something that's important. And I think that we do not have good screening tools at all. We don't have screening tools yet. Honestly, we need to start thinking about screening tools, but for every system, whether it's dementia, whether it's pulmonary function, whether it's cardiovascular function, there are evaluations that we can do for those particular systems to see where you're at. And so those are the things to fight for. Think about fatigue scales and what kind of fatigue are you feeling? Journal your symptoms so that you can bring it to your provider, can make it a little bit clearer for them as to what they might need to do for you, and understand that we might not have a solution for you that can encompass all of the things that you need, because our healthcare system is not able to provide that for folks with dementia by themselves, right? And for people who need pulmonary rehab and for cardiovascular rehab, like all of those things without COVID are not the easiest things to get access to. And so keeping that in mind, now you're adding, a long-term debilitating, multi-dimensional illness on top of all of that. It's going to be difficult. It's not impossible. There are long COVID clinics. There are a lot of really, really great physicians out there that are really trying to see what they can do to crack this code and to give folks the support that they need. But it is a thing. And so one of the reasons not to try to catch COVID is long COVID. That's one. The other thing that is important to know is that with vaccination, your risk of getting long COVID is lower, but it's not zero. It's not zero. Actually, it's about 15% after vaccination is the decrease. And it's not like, I think the number of symptoms that folks will get after vaccination is a much lower number than if you haven't been vaccinated. The other thing to understand is that it is not going to be unusual if you have long COVID and you get vaccinated, that your symptoms get exacerbated for a little bit. What everyone has said who has experienced this, that was in this conversation, what they've said is that it does get exacerbated. They weren't expecting it because nobody knew, right? Obviously, nobody knew, but you do go back to your baseline. You can get back to your baseline. And so it might be uncomfortable for a little while, obviously, because it's the same mechanism, but you will be able to get back to your new baseline of symptoms after a short period of time of experiencing those symptoms. So it's important to know these things, right? You just have to go in knowing these things. That's not to say that if you have long COVID that you shouldn't get vaccinated, because you really don't want to get it again if you can avoid it. Because if you get it again while you have long COVID, you're just even weaker to try to fight it, to fight COVID if it comes after you. So we still recommend that you get vaccinated. However, they did make the point that these are conversations to have with your provider. Like, what's going on with you? What symptoms are you feeling? How is it going? Knowing that there's a risk. What does that look like for you? And making personal decisions around whether or not this is the right direction for you to go through. And so it's really a horrifying thing that's come out of COVID, honestly. Outside of death being number one horrifying thing, there is a disability that comes with being infected with COVID. And there's a low recognition of what that disability looks like. Mm-hmm. And we're just starting, I think we're now at a place where there's awareness. Yeah. And we're trying to get everybody on the same page about these are things like, believe your patients, believe it when you feel something, talk to somebody, let them know that, listen, I've had COVID. I've been paying attention. This is not the way that I used to be. You can't just chalk this up to just fatigue, out of nowhere. This is it's actually interfering with my daily life. Yeah. And that's a good code word for you guys out there for that's a good flag for us, is that when we hear it's interfering with your life, if it's interfering with your life, mm-hmm. then we have to try to figure out what is it that we can do to help support you. And we might not have the answer, but we can try different things to try to see what we can do to help you get rehab.
Yeah, I would say, for me to add to that, I would say that the best thing, one of the things you can do is to journal or to write down things that you're experiencing, so you can communicate that to your provider, so that when you talk to your provider, you have things you've written down, that you're feeling, that you can communicate with them. Because I will give you a real life example. My grandma, she has all these kind of health issues, and then she'll go and see her doctor and she'll be like, yeah, I'm feeling pretty good. It's grandma, you were telling me you had this and this and this and this. Oh yeah, I was feeling okay that day, and I just didn't want to bother my that's their job, and your physician needs to help you. You need to tell him when you have heart palpitations, or you're feeling dizzy, or you're having trouble sleeping, or whatever. That's their job. You write it down, you remember it, and you tell them. So and that's maybe a generational thing with my grandma, but you need to write it down so you remember, and then you take it with you to the doctor and you tell them, so that your doctor, your provider can help you. And then you have, for me, I think having like kind of like a log of how it's interfering, or how with your life, or how you're feeling, I think is really important. I know that Dr. Tony probably appreciates that.
Oh, I love the journal. That is the best. I don't have a lot of patients who do it, but when I do, I'm throwing parties. I'm like, woohoo, this is awesome. I'm going to actually see what's going on here. This is amazing.
Exactly.
And it's just, you have no idea how, I don't know. I'll speak for myself. I love a patient coming to me with like, this is what happens every time I eat or whatever, and with my stomach, or this is what happens with my headache, or this is what happens with, with my strength, like, or whatever. And it's, this is what happens when I take this medication. Like, that is like, outside of me being there staring at you, taking it's the best way for me to be able to evaluate and to give you information as to why you're feeling that way. Oh, you're taking that medication too soon. Maybe if you stretch it out, you won't feel this way, or maybe take half, or now we can work together as to what it is that can try to help you achieve some type of stable place for you to feel better, right? Those journals are golden. I love
exactly.
them.
I also would say that if you're, if you think that you're experiencing long COVID, or you're having some symptoms, by writing out or journaling what you're feeling each day, you can see if it's like a trend or something over time.
That's right.
You might, every day you might be like, oh, it's just a small headache. But if that happens every day for like 4 months or whatever, you should take care of that. You should not be living with this, like a headache every day, just make sure. So anyways, that, as a detail-oriented person, write it down. Well, I'm glad that you say that about the journal, because now I know how my doctors feel when I walk in. Excuse me, I brought my list of things today.
Well, sometimes the list can be scary. Sometimes I have a list. You're like, okay, hold on, and we have to compromise on how much we can talk about. But the fact that you have it, that I think that's great. I think, and technology allows you to at least this is me with some of my patients, and I don't have the patient panel of other primary care physicians. So let me just qualify that. But just send me the whole thing, and then when I get a moment, I can read it. And then I can actually go through. And then have something to talk to you about going forward. So regardless of what it is, writing it down and being able to present that to your primary care physician is always appreciated. And at least you try to advocate for yourself. And I would say as a health equity advocate, out there, if you're not getting the care that you feel like you need, look for someone else, look for it. Try to make sure that you're finding somebody who can actually listen to you and get you the care that you need. And maybe, one of the things that what I loved about this conversation too, was just like every single physician on this call was so caring. Like they all so if they could just cure the world, they would, they just were so caring. And we're very honest about the fact that kind of the way Dr. Amy and I started the podcast, which is we're not really great at communicating. And that's a disservice to the population as scientists and as physicians. We're not doing good at communicating. Right. And part of the reason we started this podcast was to try to communicate in a clear way to folks who are not scientists, who are just want to understand the information as clearly as possible. Right. And I think that the other thing to add is one of the reasons we're not good at communicating is something that was stated in this webinar, which is that we do not like being uncertain. We are uncomfortable being uncertain. And there is a lot of uncertainty in COVID. And that makes it more difficult for us to communicate, and I was like, that's actually right. That's true. It's really hard. We hate not knowing stuff.
Well, that's what our life's work is to discover, the truth of disease and science and all of that. One of the other reasons I think that sometimes we don't like being uncertain, but one of the things that I think during this whole pandemic has been hard for the public to understand is science is always changing. So
Always changing.
sometimes when we say like, oh, this is this way and this is that way, we mean at that current point in time. And that Delta variant, then there became, other variants. Now we are in the Omicron, there's sub variants of Omicron. So anything that we say at any point in time should be taken for just that moment in time. And I think some of us are aware of the fact that if we say something like with absolute certainty, it's just going to change that next minute. And
That's
then,
right.
so we don't want to, it's a slippery slope.
It's a slippery slope. And that's why every time I say things, I'm like, in this moment in time.
Yeah,
This is
exactly.
what I understand today.
Right. Because
Will that change
right
tomorrow?
now,
Possible.
yeah, because like right now, what Dr. Tony is saying about, long COVID, it's what we understand right now. In a year from now, guaranteed, we're going to have a lot more understanding of long COVID and, maybe ways that it could possibly be treated or maybe
right.
even avoided, or things that maybe people could do to, as soon as it starts coming on, maybe having it be less severe or having, less symptoms. But right now, what we know is that it exists. We want patients to tell their providers as much as they can so that it can be documented and that more will be learned over time.
Yes, absolutely. Absolutely. And so the long story short is that there's no downside to getting vaccinated at this point.
Exactly.
There just really isn't a downside.
Right. There is not.
There just really isn't for anyone of any age,
right?
Except for anyone under 6 months, because that's the age for right now.
Right. 6 months and up can get vaccinated.
6 months
so
and
go
up
ahead and do
can
it.
get vaccinated, and we would suggest to do that.
Yep.
Is it 100%? No, but it's 100% that you will not have a good experience if you get the actual infection.
Right. Exactly. Awesome. Well, thanks for joining us. As usual, if you have any questions,
reach out.
Or email.
Yes.